All right, we're still talking about screening tests and what characteristics make a good screening test. I left off talking about, is this particular screening test simple, rapid, inexpensive, safe, and acceptable? You need to take a look at each of these and understand how valuable it is for a screening test. When it is simple, it does not need to be performed by a physician or maybe a nurse. Anyone or a limited trained individual can perform this and still obtain the necessary results. Part of the reason behind that is that reduces cost. It becomes inexpensive to be able to do that. You want to be able to have individuals in underdeveloped regions with limited training to be able to actually run this particular screening test. You need to have it be rapid, as in you do the test and you have the data that can come from it in a quick way to where you can actually make changes. Is it safe, where you don't actually have any harm that's that the participant that is undergoing the screening test there won't be any type of harm that comes from it? And is the particular test acceptable to the target group? Are they willing to actually participate in that? And we know that from educational campaigns and through instruction in that women are willing to have mammograms as a result for the screening test to determine the potential risk for breast cancer. Whereas there are screening tests that are available for testicular cancer, but education as well as outcome, those screening tests just haven't come to the forefront, and men are not nearly as willing or accepting of participating in those screening tests, even if they were available. So then the next question comes up is that not only do we determine what makes a good screening test, but now we actually want to determine whether or not this particular screening test is actually measuring what we intended to measure. How well does it actually work? And this is where we talk about reliability and validity components. I've already introduced both of those terms, but we're going to spend quite a bit of time talking about this, because remember, screening tests are used to identify individuals that are at risk within the population to then refer them on to receive additional testing and preventative or treatment methods. And so we'll talk about repeated measurement reliability and internal consistency reliability, interjudge reliability, and then we'll move on to talk about validity. So reliability is often also termed as precision, and this is where it's the ability of a measuring instrument to give consistent results on repeated trials. It's not necessarily accurate, as in, does this individual have lung cancer? It's does this particular screening test consistently have the same type of results over and over with a particular participant that's within this particular study. So the test will give the same exact result over if it was given over and over and over. And we know that there are certain screening tests that are not precise, or a particular instrument is no longer precise. For example, you can have it's known for some of the blood pressure measure tools that you can take home, that you can buy over the counter. Some of those are not reliable in the sense that you can take an individual's blood pressure multiple times within an hour-long period of time, and the individual is not doing anything different, but you can have varying results. I'm not saying that an individual, there won't be differences in their blood pressure, but it's related to the instrument or their surveillance tool not giving that precision or that reliability. And that's where repeated measurement reliability comes into play, where it's the degree of consistency among repeated measurements on that same individual on more than one occasion. So the question at the close with this is reliability concerned with a right or wrong test outcome? And the answer is no. But what you want is consistency, or you want to have precision or reliability. So with reliability, there's also internal consistency reliability. And this evaluates the degree of agreement or homogeneity within a questionnaire measures of an attitude, personal characteristic, or psychologic attribute. So here we're looking at, for example, a mental health or a behavioral health type scenario where you want to have consistency, internal consistency with the tool that you're using. And for the way that you're able to kind of get a hold of what I'm talking about is that many of you guys participated in questionnaires before. And when you participate in these questionnaires or you're filling it out, oftentimes questionnaires will have very similar types of questions. And what they're trying to do is they're actually trying to take those questions and ensure that the individual that's taking them, they're consistently answering those particular questions in a way where they will have reliability on the data that they're collecting. They're trying to look for correlation between those questions with the individual that's answering those questions. So that's the reason why when you take these types of questionnaires and you say, I just answered that particular question, or they just reworded it and it's the exact same question, it's that they're trying to ensure that you are going to answer, or that you're answering in a truthful, reliable way where there isn't that difference that could occur by just asking it once. Then there's inter-judge reliability, and this is the reliability assessments derived from agreement among trained experts. And so this is a scenario where you have multiple judges or multiple individuals that is taking subjective data, and they want to see if there's consistency or reliability among each of the ones that are judging or each of the ones that are evaluating the data to see if they're coming out with the same outcome or the same, they're in agreement with how that particular type of answer. So when you look at it from a social science standpoint, you can see how important internal consistent reliability as well as inter-judge reliability is when we talk about behavioral health and the difficulty that it is when you're collecting that type of data. So then we talk about validity, and this is where we use the term accuracy, and it's the ability of a measuring instrument to actually give the true measure. Is it measuring what we actually want it to measure? Is it actually measuring the disease outcome that we're trying to measure? Or does it actually measure that this individual has high blood pressure? Or does this tool actually identify an individual that has autism? And it can be evaluated only if an accepted and independent method for confirming the test measurement exists. And so when you talk about it from a biological standpoint, validity is, you're looking at tools that are out there within a laboratory setting where you can back it up. For example, if you do a screening test with an individual that has strep throat and you do a rapid test where you are able to take a swab and then run a quick rapid test, an ELISA type test to determine whether or not an individual has strep throat, is there a way to determine that particular screening test is actually accurate? And is there a way to retest it using the gold standard that's been widely accepted and independent for confirming whether or not that measurement is actually measuring what it's supposed to? So it's easy to see it from an infectious disease standpoint. It's easy to see from a biological specimen screening test. But when you look at it from a behavioral health standpoint, it becomes much more difficult because of the the potential flaws that can come within a particular screening test. So within validity, there's ways to break down this for different types of analyses that are out there. And for example, there's content validity, and this is the degree to which a measure covers the range of meanings included within the concept. And one way that I like to try and use this is that, for example, for you to try to get your head around what content validity is, that are we actually measuring within our screening test what we intend to measure, and does it cover that particular range of behaviors that we're trying to include within that? So you can look at it from the perspective of evaluate the spectrum of what we're actually trying to measure. So if you're trying to go and evaluate an individual using a screening test specific to mathematical learning, as in the SAGE test, for example, at the end of the school year, are you actually taking into account and asking questions across the entire spectrum of content, but are you only measuring are only asking questions specific to multiplication. And so you know that you're missing out on division and you're missing out on fractions if you're not covering that entire spectrum within that surveillance tool. And so that's where you can have a lack of content validity because you're not actually covering that entire range. With criterion reference validity, this is found by correlating a measure with an external criterion of the entity being assessed. And I want to move real quick to the next slide, because within criterion reference validity, you can even break it down even further. So two aspects of criterion reference validity is predictive validity, and this denotes the ability of a measure to predict some attribute or characteristic in the future. So what we're trying to do with criterion reference validity is that, specific to predictive, is that if you take a measurement, an early measurement, does this denote or does this mean that this individual could potentially or likely develop heart disease or have heart disease? And so if you take a blood pressure reading, how valid is a high blood pressure reading with one's potential for developing heart disease? And so that's where you need to have correlations and data that's collected to determine how predictive and accurate is that particular screening test for determining one's outcome of disease. And then you have concurrent validity, and this is obtained by correlating a measure with an alternative measure of the same phenomenon taken at the same point. So for example, with concurrent validity, you self-administer yourself. An example that I use is that could you self-administer a depression evaluation and then actually go in and have a psychiatric diagnosis, and how valid is that particular type of test that's out there? So here you're trying to take a measure, a tool that may be out there, and you're trying to determine how valid is that particular tool taken at the same time. So I can take for example, I could do a questionnaire for my mental health or where I'm at with mental health, and then walk in and then talk to a psychiatrist and determine whether or not that particular tool is all that valid compared to a gold standard scenario. Many of you guys have participated or maybe have gotten online and done different types of self-administered tests, and that's where it's really difficult to actually understand or know how valid some of these tests that are out there. But it's just not for mental health. I mean, there's also risk assessments that you could take, a 5-minute type risk assessment to look at your risk for developing hepatitis. And you have to ask yourself, are you participating in these types of risk behaviors? And are you at more risk for then developing a disease or having this particular disease, and then go and receive the test as a result? And then there's construct validity. And this is the degree to which a measurement agrees with a theoretical concept that's actually being investigated. For example, if you're the resident expert and you're trying to develop a new test for determining or identifying depression, and you're actually then trying to correlate that with a psychiatric diagnostic method. So with construct validity or accuracy, you're actually one that's developing new tools, new screening type tools, and you're investigating whether or not these tools are all that accurate and could replace screening tests that have already been validated.